Hello, everybody. Welcome to the American Enterprise Institute. I'm Yuval Levin of AI, and it's my pleasure just to get us started this afternoon. This event is part of the Edward and Helen Heinz book forums here at AI. These forums provide a platform for us to host prominent authors, to talk about their new books, and particularly to focus on books with real significance for the national debate. We're grateful to Edward and Helen Heinz for their tremendous support of AI, for their commitment to our mission here. And we're grateful to Jonathan Rosen for being here for this conversation. His book has been getting a lot of attention, getting great reviews, and this is really just the sort of book for which this series here at AI was created. It's a gripping book, it's powerful and illuminating, it's a human story, but it's also a book with real significance for what it has to tell us about how our society approaches questions of mental illness, for how we fail to offer meaningful help where help is needed on that front, for helping us think about how systems in our society relate to lives and what that can tell us about how to make things better for people who need help. Jonathan will be in conversation this afternoon with AI's Sally Satel, who's been shedding light on just that set of questions for many years now, and is really the perfect facilitator for exactly the kind of conversation that this book wants to start. I'll just briefly introduce Sally, and she'll then take over, tell us a little bit more about Jonathan and about the book, and they'll go from there. Sally Satel is a senior fellow here at AI. She's a practicing psychiatrist with tremendous amount of experience providing care directly to patients, and also a long record of scholarship and writing on the state of psychiatry and mental health provision and medicine in general in America. Her many publications include the books When Altruism Is Not Enough and Brainwashed, The Seductive Appeal of Mindless Neuroscience. She's long been deeply concerned with just the kind of questions that this book takes up. And so with that, I'll get you started. Go ahead, Sally.
Thanks everyone for coming, and of course you. And this book, and hopefully there'll be enough for folks, is an extraordinary memoir. And that's its core, at least the way I read it. But it's an exploration of just so many other things, and an indictment of so many other things. So we'll get to that. There's so many tendrils in this book, and I want to touch on as many of them as we can in an hour, although we'll have, I guess, 50 minutes, because we'll have some time for Q&A as well. But let's start, I guess, where all discussions of books start, which is what's the story?
It's actually always a hard question to answer, because the story is, there are a lot of stories, and there were stories I had to untell as well as tell. But 25 years ago, my best friend from childhood did something horrible. He killed the person he loved most in the world. He had been very celebrated for completing Yale Law School despite having schizophrenia. And he had been celebrated in the New York Times when he wasn't hired, but he had decided to come out, as he put it, as a flaming schizophrenic. And there was a very, really heroic portrait of him in the New York Times. As a result of that, his story sold to Hollywood, his story sold to a publishing company. It was a proposal that he was going to turn into a book, a memoir, and Ron Howard was going to make a movie about his life, and Brad Pitt was going to play him. But then he stopped taking his medication, and he killed his fiancée, who was pregnant, who he lived with. But my book actually begins 50 years ago. And in a sense, realizing that the story I was telling began in my childhood when I moved to New Rochelle, which is a suburb of New York, and I moved onto the same short street Michael lived on, and we became best friends. So we were childhood best friends. I was 10 when we moved there. And the story is really, as I say, it's about a lot of things. Its core is my friendship. Its core is my reckoning. Its core is the story, but it's realizing in a sense that I had to go back to a time before it seemed like a tragic inevitability, which is what one of Michael's law professors later referred to it as. But I thought it was better to simply go back. And what I'll say is just, it was very, very hard to know how to organize something so large, because I knew Michael had killed Carrie. No, everyone knew that. But the more I reckoned with that, the more it felt like a murder mystery, because there were so many elements of the culture over the years that had only seemed like the backdrop when we were growing up, about how people care for people with mental illness, how they understand it, how they fail to understand it. And the book is really organized in 4 houses. The first section is called The House on Muirland Road. That's the name of the short street we shared. The house on Muirland Road is my house. The house on Muirland Road is Michael's house. He lived across the street and down. I always thought of it like the way a knight moves in chess. And the second house is the House of Psychiatry. And there really was a big house in New Rochelle owned by psychiatrists. Michael lived in the attic when he was trying to be a writer. We both wanted to be writers. And the psychiatrists who owned the house and a circle of friends around those psychiatrists sort of provided his care, formally and informally. And in a way, it's a real house. They were real psychiatrists, but they also grew out of and helped create the community psychiatry movement that was played a very large role in the way we care for people or try to care for people with severe mental illness. And the third house is the House of Law. That's also a real house, because Michael went to Yale Law School after he had his psychotic break. And it was an actual place, and the law professors Michael found there were really his mentors. But they had also clerked for judges in the 50s and 60s who had changed the laws, the commitment laws. And so, again, it was a literal place, and he was there, but he was also there with people who were themselves, who had played a role in the care of people with mental illness or severe mental illness. And the last house is a house of dreams, which is Hollywood. Because they were going to make a story. But one of the things I quickly understood is that the houses are very leaky. I mean, the House of Psychiatry was built by Cecil B. DeMille, and psychiatry and law had really married, snuck out and gotten married, and lawyers were behaving in certain ways like psychiatrists by determining who could and could not be hospitalized, and psychiatrists were testifying in courts, and they were all the House of Dreams. And dreams were not just what you analyzed in psychiatry, but also, in a sense, there was a dream of a kind of care. And so all of these things were swirling around, and that's what I was reckoning with. And a lot of the people in the book are also doing that. One of the law professors, who was one of Michael's mentors, said to me at the end, he said, "Don't blame Hollywood." I was saying how unusual it was, how painful and strange it was that somebody who had literal delusions and a grand sense of himself was going to be played by Brad Pitt, and millions of people were going to see his story. And he said, well, don't blame Hollywood, meaning I think Hollywood is in the business of dreams. He said, if Hollywood's to blame, we all are. Because he said Yale Law School gave the story to the Times, and the Times gave the story to Hollywood, and probably his friends gave the story before that to Yale Law School. And what he meant by the story wasn't the actual accurate story. It meant the generous elisions or additions to his story that were done with, as the subtitle of my book is, the best intentions, but that in their way ramified not just from one piece to another, but also in law and other things. So I hope that's the longest answer I give, but you did ask me what it's about, and it took me 10 years. So.
Everyone can understand now why it took 10 years to write. Which you did, right?
It did. The hardest part was the simplest part in a way, because going back to be 10 was not about making an argument. And the best advice my editor gave me was to write it like a novel, by which he didn't mean imagine it.
Yeah.
He meant experience it. And so it made it harder to be as angry as I sometimes felt, because it's really like, what was it like to be a friend? What was it like when this happened? And that feeling was what I held on to, because obviously that was true for all the people making all those decisions. And some of them were living inside of a world in which many decisions had already been made or turned into agencies or bureaucracies where you're not even making a decision anymore. You're just, someone got inspired by One Flew Over the Cuckoo's Nest, and a false notion of both the institution and the people in it was turned into laws that changed the culture more. And so it was my effort, it was a reckoning, but my effort to just live inside of it.
And that impression from the film like One Flew Over the Cuckoo's Nest is that people who are in asylums really aren't that sick, or their sickness is that they're bumping up against the constraints of society.
Well, what was interesting is that the main character in One Flew Over the Cuckoo's Nest in the film especially is not mentally ill at all.
Right.
He's there like a Kafka character. He just woke up. Somebody must have said something about him because there he is. In the book, he's committed statutory rape, which they would obviously eliminate for the movie. But there's really no accounting for his being there. He's simply trapped. And so he's a victim of not just circumstances, but power and authority. And the movie was made by Milos Forman, who had fled communist-controlled Czechoslovakia and who simply saw in the novel his own situation. As he said, Nurse Ratched is the Communist Party as far as he was concerned. So the movie has nothing to do with severe mental illness. And the book itself, written a decade before, was written when Ken Kesey was part of MK Ultra, the drug testing program, and he liked the drugs so much at the VA hospital, he got a job on the night shift as a janitor, and so he could help himself to hallucinogens. So as far as he was concerned, the other people he met, he was in the psychiatric wing, were just like him, perfectly ordinary people who were just victims of an oppressive state. So what was essentially a metaphor for something was taken actually by people who were responsible for the care of people with severe mental illness as real. Yeah. That's, in other words, the delusion, it became a kind of concretized hallucination in a way.
Yeah, and so many of those people became part of the anti-psychiatry movement. I know that. That's one of the things that you've always mentioned that I've looked into quite a bit. So as I said, it took a long time to write, understandably. It's just masterfully woven. But when did you decide you had to write it?
I'm not sure. Once I did, I think I probably felt that I had been resisting writing it for even longer than I would have spent writing it, but not so much resisting writing it as resisting an encounter with all that it meant. And I had no idea what it meant. It wasn't a story that I felt I was encountering. It was a feeling, partially of horror. Michael was not just my best friend, his mind worked much better than mine. So he was really a touchstone of like high mental functioning. I mean, I didn't know it, but I have learning disabilities. I read incredibly slowly. I have dyslexia. I learned it only when I had kids. And so I was always counting around the table at Passover for when it was going to be my turn to read so I could practice. And if your aunt went to the bathroom, you were screwed because you counted wrong. But Michael had a photographic memory and he read amazingly fast. And so first of all, we were very competitive and we both went to Yale. He graduated in 3 years, but I think we measured ourselves against each other, although he was not just literally taller, but it was more of the measuring stick. And so I think it was partly just why him, why not me? We were parallel in certain other people's expectations. And so it was bound, and then the guilt of competing with someone. If he was the hare and I was the tortoise, but the hare had run off a cliff and I was busy thinking he's coming, because he was so smart. And he also had he took up space cheerfully, let's say. His house was very different from mine, even though our fathers were both college professors. And so I don't know when I felt I had to write it, but as I was writing it then, it was both recalling my own childhood, which was painful for me for various reasons, but then the pleasure of being inside of it. And then it was also just discovering little by little all of these things that seemed random. I'm in graduate school at Berkeley at some point, and for some reason to study literature, I had to read Foucault's Madness and Civilization, in which all mental illness is a social construct for the simple purpose of othering people who are enemies of the state and so that his whole theory is that asylums were created essentially in the Enlightenment to lock away the enemies of reason or of whatever people in power disliked. And so it was merely a social construct. But when I visited Michael in a locked ward when he had his psychotic break, there was simply no question. It took about 30 seconds to realize he was not suffering from a social construct. And he was in a locked ward, not because the state had decided he was an enemy. And that was even more appalling, although it ruined graduate study, which was a blessing.
I don't know how many folks have ever known up close someone who has a psychotic illness or someone's in a manic phase, because, when I started residency, I really hadn't. And it is so just qualitatively different it is not on a continuum with, even grandiosity that someone might have. It is a delusional state in some folks, and this is a severe version, of course, but where they're just convinced that they are, Jesus Christ or some sort of incredibly powerful entity. And frankly, sometimes, you get scared being around them. Not that I've ever been attacked, but that's another, speaking of that, there is the violence thread. And that's in addition to all these other emanations of the best minds, kind of what the legal theorists thought, and then ended up essentially watering down or fighting commitment laws because, as someone has written, I forgot, maybe it's Paul Applebaum, that they'd. I think their intentions were were very good, but still this notion of allowing people to die with their rights on, that there was the extent that ideology kind of blinded people to the truth of how severe and almost sometimes otherworldly these illnesses can seem when you're with someone. So that would, completely obliterate any kind of romantic notion or sense of what these conditions are. They are really radically different than, as I said, just someone. Because again, with mania, you think of intense excitement. It's just not a little more excitement, or not just fantasies. These are delusions that people inhabit, and it's scary to them, and often, and scary to others. You mentioned your dad, and he was a Holocaust, his parents were Holocaust survivors. He was sent here when he was 6. But that reminds me of one thing that I was really struck when I was reading it, that there's kind of a motif, a Nazi motif that runs through the book. And in terms of in real life Nazis, and also how they manifested in Michael's delusions. And I was wondering, and of course that brought me to the Jewish tradition that you were both raised in, and the Cain and Abel metaphor. And so I got a sense that somehow one could even call this a kind of a Jewish book. I wouldn't put that first on the list, but it definitely struck me that way. But do you know what I mean when I say that? Can you articulate it better?
What makes something Jewish, of course, is always mysterious. One could speak for a really long time, but I know exactly what you mean. It doesn't change your question at all, but my father's parents were killed. And the reason I mentioned
pardon
that...
me. Did I say it the wrong way? And you were named...
It wasn't that. I think a reviewer also said he decided he was 6. He was a teenager. He was on a kinder transport. He left Vienna alone, and his parents were killed. The reason why I mentioned that is simply because, again, since I was filtering everything through my own experience, Michael's house seemed, although it was a Jewish house, his parents were born in America, and our parents were both professors, but his father wore like a leather bomber jacket, and his father was professor of economics, and he had brothers, so there was this kind of booming energy in the house, where you even like to be invited for dinner. If you didn't eat fast, it was over. My house, I had a sister, and if you played Monopoly, she would let you get the colors you liked, and you would let her win, but she beat me anyway. But the point is only, it was an endless deferring. She's named for my murdered grandmother, and I'm named for my murdered grandfather. And it was so there was a kind of old world aspect to our home that was different. Michael was very interested in my father's accent, and was curious about where he came from. And so what was, in addition to everything else, this American quality was extraordinary to me, that when Michael began to become delusional, he literally saw Nazis in the streets. They drove him off the road. He had written a thriller with Nazis in it, and he burned the book because he felt the characters had come to life. And he thought his parents were Nazi replicas of his actual parents who looked just like them but had killed his parents. And that was when he was hospitalized the first time. And I remember the terror. You spoke about fear, just my mother's terror when she reported this to me. It was partly just the sense that your parents, the most primal relationship, would seem as if they were the most evil thing you could imagine, and that you had to arm yourself with a kitchen knife, as he did, to protect himself from this evil. And so it was extremely strange in that way. And I think also because I always thought, what happened, Michael's story always seemed so anomalous and extravagant, and I didn't know anything about severe mental illness. Everything seemed like it would be peculiar to my own experience or to his. The idea, though, that the Holocaust loomed so large in post-war America, that it seems to have transformed psychiatry itself. When you have someone like Irving Goffman, who was not a psychiatrist, but a sociologist, published in 1961 a book called Asylums. He likens asylums to concentration camps. They're total institutions. And when there's the early exposés about the dreadful conditions of state hospitals, it was conscientious objectors during the Second World War who smuggled out, who were doing alternate service because the staffs of state hospitals had been drafted. And so they were at their worst. They were swollen with patients even more than usual, and half the staff was gone. And there they were, and they saw people naked, huddled, who looked like they were liberated from a camp. And so people who had actually been conscientious objectors during the war smuggled out pictures that looked as if they'd liberated a domestic concentration camp. And the article that went with it in Life styled it that way, as if, in fact, these pictures were reminiscent of the ones everyone had simply seen. Psychoanalysis, which did see all mental illness on a continuum, instead of using a medical model, was able to prolong its psychoanalytic embrace because what the Nazis had done with biology and genes seemed so barbaric that, in a way, anything that got away from any acknowledgement of biological difference seemed moral. And so for all of these reasons, and it was just the great ready metaphor of evil. I mean, in The Feminine Mystique, Betty Friedan likens houses in suburbs to comfortable concentration camps. She also says unhappy mothers will produce children who have schizophrenia and other, as she says, other abnormal children. In other words, an argument for finding a remedy for the unhappiness of women who didn't want to be where they were was to prevent schizophrenia and to, in a sense, avoid something like Nazi-like. And it was simply there. And the Milgram experiments in the basement of Lindsley Chittenden Hall at Yale, which became the English department, were devised by a psychologist who was was horrified by the Holocaust, but also had just watched the Eichmann trials. And the experiments were in 1961. He was sort of testing for proto-Eichmanns to see if you would follow orders and harm someone. That was the experiment. And so everything had about it this misapplied, though understandable, metaphor for radical evil. And that too became blended. Any form of confinement was confinement in a concentration camp. Any form of biological application of science was experimentation. And Michael was terrified in the hospital that he was going to be lobotomized by Mengele. It's just one of those elements woven into the texture of the culture, actually.
Well, speaking of institutions, that's a good segue. You know, I remember when I wrote you and invited you, and I said, well, you know, AEI is a policy institute, and this book doesn't have that much policy in it. And of course, that's deranged. It has enormous policy implications and discussion. But I think I was just so mesmerized and you know, captivated by the story. It was the human part of the story, but it has, you know, significant policy implications. And since you mentioned institutions, it was kind of, in a sense, kicked off, at least from a policy standpoint, in, I guess, October 31st, 1963, when President Kennedy signed the last bill he would ever sign, called the Community Mental Health Act, or Centers Act. Right. And those centers, I don't know if you want to take the story from there, because the people who devised the system we have now, which is to say one that has just gaping holes that sick people just fall through routinely, was kind of devised by one of the several species of best minds that you discuss in the book.
Right. So, yeah. I mean, what I'm always thinking is where to start, where to end, because there are so many pieces to it. It was a very good and humane idea, which was that state hospitals, which were confining people who, thanks to antipsychotic medication, which had come along in the 50s, no longer needed to be there, could live in the community. And the way Kennedy formulated it was something like, you know, the cold custodial isolation of the asylum will be replaced by the warm embrace of the community. But A, it's hard to legislate a warm embrace, and B, one of the things I'd say is that when antipsychotic medication came along in the 50s, it didn't come along because psychiatrists of the day thought there must be a biological connection. They were psychoanalysts, and they were psychoanalytically inclined. It happens, like a lot of psychiatric drugs, which you know much better than I do, where they're accidentally discovered. And it worked first to keep people calm after surgery, and then someone tried it to see if it would keep psychiatric patients calm, and then lo and behold, it masked certain symptoms. So there was a drug available. But when Kennedy spoke, and this was partly because these are the people advising him had suggested this, he spoke about how we would focus on prevention and treatment and cure. And there was no prevention, and there was no cure. And so the terms were already changed. And also, in a way, if you're going to replace psychiatric hospitals with something that you call community mental health centers, you're replacing something that stands for severe illness, that is for people with severe illnesses, with something that treats people who do not have those severe illnesses. And now you can justify that if it's prevention and it apply in a public health manner, because everybody needs to feel, you know, weller, better, less anxious, less ill. But if the very definition of mental illness had changed, and it changed in a sense that ceased to refer to those who had needed care in state hospitals and became a kind of generic, fungible term that we all live with today. When you read, you know, anything in the DSM, the diagnostic manual, is a mental illness. So arachnophobia, fear of spiders, and schizophrenia, they're all in there. They're all covered by insurance. And so they're all construably mental illness. And the very idealistic people who were then implementing the plan were themselves inclined to believe, because they too had lived inside of this world of psychoanalysis, that environment made you ill. It used to be the family. Mothers were called schizophrenogenic. They literally were thought to cause schizophrenia. But then it was not just the family, it was the city, it was the neighborhood, it was the community, in which case poverty, racism, being marginalized, these were all sources of illness. If that was the case, then fighting those things, like the war on poverty, became a kind of war on mental illness. Meanwhile, the people who were released were severely ill. And the thing that brought it home for me was reading a memoir by a guy, a really interesting memoir. He had run the Baltimore Community Mental Health Center in 1968, 67, before the riots, and then 68. And it was a very idealistic band of psychologists and psychiatric social workers. And what he says is the one group of people we knew we didn't want to take and weren't going to take were people released from state hospitals. Why? Because we thought everybody in the community, and they were mostly poor and black, needed our care. And the amazing thing, and he actually acknowledges this, is the people who were just as poor, just as marginalized, just as discriminated against, but had the additional bad fortune of having children or an aunt or mother or father or sister who had a severe mental illness and had a psychotic break, didn't have access to those centers. And what did? They called the cops. And you can literally watch idealistic people devoted to mental health criminalizing severe mental illness. It would also be like if you closed Sloan Kettering and said, we're going to replace it with mobile cancer units. But you decide that everybody needs to prevent cancer, so they should all learn yoga and healthy eating habits. But somebody with stage 4 cancer comes for chemotherapy, and you don't have that for them because you're focused on something else. And it's also bound up for me with I guess you'd call it the abuse of a public health mentality that needs to treat everyone in order for anyone to get treated. And severe mental illness is not like that. And so it was a misapplied formula, understanding of what illness really was. It was also a failed notion of what kind of care people needed. Handing people medication was not sufficient if the symptom of your illness is that you're not sick. When Michael stopped taking his medication, my friend, he thought the medication was poison. And so there's obviously a need for all the things that the society at that moment was least comfortable with. Any form of coercion, any form of care until someone, if someone is not, the necessity of deciding that there is a line, even if it's hard to find the border, it exists between what's real and what isn't, and what it means to help someone who doesn't know anymore or who thinks his parents are Nazis. And then there was even, to throw in one more thing, at that very moment, psychiatrists like R.D. Laing, very influential Scottish psychiatrist and a wonderful writer, who claimed that schizophrenia was the only sane response to a mad society. And so there was the romanticization of the illness. So you weren't merely indifferent to those who were ill. You were making a positive virtue out of the illness that, and that's a whole other, and building it into the culture. And the opposite, therefore, would be an antipsychotic drug, since LSD was thought to induce hallucinations and symptoms of psychosis, and that was mind expanding. Then who would want to suppress the very thing that seems like the living emblem, almost like a prophet or a seer? And so there were so many inverted elements at the very moment when there needed to be something specific. And how do you help people in that situation? And it was the state hospitals that had cared for people for over 100 years. And the psychoanalysts who were behind the idea of making it all a federal project were old New Dealers. They didn't want the states involved. And one of the most shocking things for me, I know, like, policy was harder for me to understand than brain science. But the idea that Medicaid doesn't cover people in state hospitals. So there was just an economic incentive to release people if you were a state.
Right. So, and part of that policy, to deinstitutionalize the idea is to get people, again, out of these, totalizing asylums and into the community, which wasn't ready for them in terms of the number of clinics built, in terms of the interest of the psychiatrists in working with them and the skills of those psychiatrists to work with them. But part of it also was a policy called the Institute for Mental Disease, IMD exclusion, which means that we don't want to start another institution in a hospital, so we will only allow, or Medicaid will only cover psychiatric care inpatient in places where there's 16 beds or less. And so the jails, the trans-institutionalization started, decades ago with the jail and even prisons being, I think the LA County Jail is, for quite a while, it's been the biggest mental institution effectively in the country. Because
Right.
about 15% of inmates, I believe, are considered mentally ill. And I mean mentally ill, not mental health problems, which is an illusion that gets made way too often, especially by the Substance Abuse and Mental Health Services Administration. So yeah, you actually can draw. I mean, there are so many. I mean, you can see how many just like arrows there are in this book if you had to kind of draw a portrait or a tableau of the forces that influence the people with severe mental illness. But where would Michael? I mean, he was embedded among people who were fairly enlightened, even though I think it sounded like they saw hospitalization as so much the last resort. I mean, it is the last resort, but to them it was a resort 10 miles away, and maybe to us it would be a mile down the road. And he stopped taking his medication. My impression was it stopped being effective, which sometimes happens with these psych meds, but is that not right?
To me, that in fact was the order of things.
Mm-hmm.
I'm not sure,
Okay.
but can people still hear me? I can no longer hear myself.
Uh-huh.
I thought so. I was thinking, what's that huge noise behind me? So, good. Does this
It's perfect.
work? Good. It's complicated. The most painful thing is that the people who felt they were honoring his autonomy and were therefore respecting who he was and felt that it wasn't their place to intervene at all were not honoring his autonomy at all. They were sort of facilitating his growing illness. Whether his medication stopped working or whether he had stopped taking it is unclear, because when he was found unfit to stand trial, and then his family and his lawyer requested that he be medicated, he then was fit to stand trial. And so it was always reported that way, but it was one of those things that was just assumed. And the medication is, as you know, can be very unpleasant. But it's also the case that he was not taking it. And the people caring for him had come of age at a time where saving people from the system was, in a sense, the goal. And so there weren't really that many mechanisms available to them, but also it did not occur to them. And the people I talked to were quite honest about this. Even one member of this informal group of people, which called itself the Network, who didn't think it was good for Michael that he was going to be turned into a movie, and didn't know that going to Yale Law School was in fact the best thing for him when he was just out of a halfway house. She said what they thought would happen was that he might have another break and then never get out, or get out because they often didn't hold you, but endlessly participate in what was called the revolving door. But it was also the case that he was living with someone. And Michael's roommate from college, who I was friends with, who died before I was able to speak to him, he had cancer. He died quite young with 3 young children. But his brother told me that he really loved Michael, but he had died weeping for Carrie, the woman Michael killed, because he said all we ever thought about was making sure that Michael was accommodated, and we didn't think about her. And that was very much on my mind, that it was important not to let her disappear from the story either, because it's never a single person, either who's doing the accommodating or who's being accommodated, and what it would require and mean, really. So, and he was also, he was successful, and everyone assumed that to be successful was, in a sense, to have defeated your illness. Everyone assumed a lot of things we grew up assuming. Being smart, that was somehow not even an instrumental, it wasn't the thing that was going to help you do something. It was the goal. And it was really important to me because I read so slowly. I was like, I can't do anything normal. I better be smart. And Michael really was so smart that it was mistaken in a way. And he used to say, I may be crazy, but I'm not stupid. And his law professors, and this was also a revelation for me, saw him as brilliant and immediately understood he couldn't do the work. And so it was as if brilliance was no longer even for them something that would allow you to do legal work and become what he hoped to become. It was almost like he belonged because he had a quality that therefore was like he was a natural aristocrat and could therefore participate in that new culture that they had entered through a very different door. But they also saw their own brilliance and arrival there as giving them a kind of authority, so that one of his professors said to me, I never thought Michael would become a Yale lawyer. I assumed he would be a spokesperson for people with schizophrenia who had been to Yale Law School. But when it was recommended to Michael when he was still in a halfway house that he work at Macy's or that he work at a supermarket, that he begin doing something small and slow that would allow him to recover as much of himself as he could, and he decided to go to Yale Law School, he would say, why would I bag groceries when I could be a Yale lawyer? Being a Yale lawyer was the point. And so his accommodation was actually a gap between reality and his perception of it, not because he couldn't perceive reality, but because out of a kind of generosity of a sort, that accommodation was made. And when the Times wrote a profile of him, all of that entered the profile. He was given a fellowship that was created for him to extend his stay for 2 years. He told me immediately it was in recognition of his genius. And so that became part of his heroic story also. And everyone was very eager for it to even be a story. When I said I felt I had to untell stories, it was partly because the Times article ends with the dean of the law school saying he has conquered his illness, and can be a law professor, or is fit more than many. But it's not an illness you conquer. And so already the wish for a story was present in as if that were a favor, and that's the other piece of it. We want to be writers. To tell your story meant to us to defeat the forces arrayed against, to defeat life was to tell a story. It wasn't just that the victor tells the story, but to tell the story makes you a victor. Mm-hmm. And the thing that was most moving for me was when I read a book, you mentioned the Holocaust, by Lawrence Langer, who's a professor of English. He talks about Holocaust testimonies. He studied the Yale video archives of Holocaust testimonies, and what he says is that people keep assuming that their testimonies and their stories will bring them relief, because that's what people assume about literature, but it doesn't bring them relief. It actually often fills them with horror, both because of what they've done and because the story lacks that power. And so to watch, again, the way like the Holocaust was absorbed into everyone's metaphorization of their own condition, the use of stories by psychiatry. Freud decided talking and formulating a story would make you well, and Greek and a myth made you ill. And since he thought everyone suffered, he didn't treat people with severe mental illness, but American psychiatrists influenced by Freud did. They just assumed that everyone was suffering for the same reason. And so they were literally applying literature. So again, I did the audio version of my book, and I would always wind up like having to retake something because I'd somehow knocked the microphone off its perch. So I will attempt stillness.
Okay, we have a few more minutes before folks can ask questions, but so going back though to the specific part of the story, what you said, it's not clear what really led up to, the tragedy, the second tragedy. The first was having schizophrenia, but the murder. So Michael doesn't fit, a classic sense of people falling between a crack in the system, and now I'm ending on retail. You can just hold it. Retail policy. But now in New York City, there is an attempt to, by Mayor Adams, to really plug a crack in the system for people with the homeless, severely mentally ill. Do you have just some closing thoughts that might revolve around that?
Sure. I thought about it because a piece of my book was turned into an article for The Atlantic. Editor of The Atlantic's here. I'm very grateful to him because it forced me. It used to be when people said, "What's your policy recommendation?" I would say, "Don't lie if you can avoid it. It doesn't help people for whose sake you think you're lying." But in a sense, what Mayor Adams, it's a very limited plan, which is that people who are too ill to know they are ill and too impaired to care for themselves, who are unhoused, not homeless, but not even going to shelters, that they can be brought to hospitals, not committed by police officers, but brought to hospitals to be evaluated. That is the plan. What was fascinating about it was the response to the plan, which described it as if it were a grand roundup of everybody. Where they were going to be put, no one said. And also, I remember the Times wrote at one point, like, mentally ill homeless people will be hospitalized even if they're not violent. And what's amazing about that is that it was as if violence was the only symptom that might get you care, even though if you're ill and can't care for yourself and are dying in slow motion, let's say, you need care. And the other argument that was made against it, and this is an understandable one, is that there are so many holes in the system, as you mentioned, that taking people to a hospital where they'll be evaluated, perhaps they'll be hospitalized, but only for 72 hours, let's say. Then they'll be released. There isn't adequate housing. All the things people know that severely ill people need if they're not going to be in the hospital. Housing that has services brought to the people who live in it, integrated into it. Inter-community interventions or teams, whatever it's called, assertive community treatment, teams of people. All of those things are not in place, but some of them have to be done by the state. For example, he's just the mayor of New York. The state has to create hospital beds. There aren't enough. We lost 1,000 beds to COVID. For me, that's really the question. Like, who decided hospital beds for severely mentally ill people are like elective knee surgery? It wasn't necessary during the pandemic. But in any case, only half or a percentage of those beds have been retrieved. So the governor has to do that. The federal government has to decide that people in long-term care facilities, in fact, the state can get reimbursed if they're in a state facility through Medicaid, which is an enormous provider of care for people with severe mental illness. It just doesn't provide for long-term care for the most ill people. So it exposed every failing in the system, and to have to replace every piece of the system that's broken in order to begin by doing one thing would be the ultimate cynicism to expect it. And he has a wonderful advisor, Brian Stetton, who basically I've heard him say, it's just, if you think these things are necessary, argue for them. But if you think it's wrong to bring people to the hospital who are in desperate need of care, then at least say that. And don't pretend you're defending people's liberty or autonomy, because that's not the situation. And so I think it's a beginning, and I think it's an important beginning, and I hope that people will not be allowed to pretend that they're arguing for someone's autonomy and not noticing that jail or the morgue are the other alternatives, and simply instead treating it like an abstract civil rights argument. And I would never have thought any of this, if I hadn't known Michael in childhood, and he was not living on the street. And even then, it's easy to understand how fraught with good intentions that produce tragic outcomes his life has been, and the death of the person he killed.
Yeah.
So I think it's a good policy.
No, I agree. The commitment laws, in every state will have a commitment law that will allow you to be involuntarily at least detained and probably committed to care if you're about to kill yourself or someone else. And then there's another standard that's less common, but I don't know how many states have it. I think more than half, which is called a grave disability standard, which would be basically if you're so psychotic that you think your food is poisoned and you're starving to death, or you're freezing to death in the park because if you go inside, you'll be killed. That's a grave disability standard. And most states, I believe it's most, you can respond to that. And then there's a third one that's barely used, which is a need for treatment standard. And you can imagine ways that could be fudged, but with such a bias in the system to not admitting people, a person who, I really don't worry about abuse of these laws at all. I worry about them not being existing or not being enforced when they do.
Yeah.
And, yeah, so anyway, I think it is 5:20, so first question.
Thank you. So presumably, Michael is in custody now and adequately medicated, and you remain friends. Has he had time for self-reflection, and what are his thoughts about this story and its various implications?
So I'm afraid a lot of the pieces of your question I have to say no to, in a way. I mean, he was found not guilty by reason of insanity. He's been in a forensic hospital for 25 years. Whenever I visited him, I never asked him about killing Carrie, but he never acknowledged that that is what he had done, and I wasn't there to interview him. I had just visited him, and it was clear from the things he said that that was not how he thought about it, because he was still very ill, and his illness waxes and wanes, and and don't forget also, to speak of reflection, I mean, in a sense, if he were in a position to know precisely what he's done, he would know that he killed the person he loved most in the world and his unborn child. And not to know would be to remain in a kind of state that I encountered him in, which was still shaped by paranoia, but almost as if that was, I wouldn't say, never say a better place to be. It simply was the place he was in.
Psychoanalysts would say that he was
Right.
protecting himself from that. And
But
we'll never know, but-
and so it doesn't. There's no repair in that sense in the book or in my life or in his life, because all these things happened. So even though I went back when I began my story, so it could move forward, not seen only through this tragic scrim, it did happen. And the world after it is aftermath in that sense. And that's part of it as well. And I guess I didn't want people to experience it the way a reader of the New York Post would have, because it said psycho in giant letters above a picture of his face. And so, you know, having been what was literally called a poster child, because he was made a kind of hero and spokesman by a newspaper article. 3 years later, another newspaper article made him the emblem of everything people fear and dread. And in fact, the movie he sold, which was not made, the month he killed Carrie, Vanity Fair excerpted A Beautiful Mind, and Ron Howard bought A Beautiful Mind. Frank Rich, who had been a theater critic but was then a columnist for the Times, and who has an interest in mental illness, wrote that he hoped that the movie the screenplay would still get turned into a movie of Michael's story. And indeed, the screenwriter, who had written Mississippi Burning, was a very good screenwriter, kept trying to incorporate it into the story, but knew that that was not going to happen. And what Frank Rich pointed out was that, of course, it wasn't going to happen because Hollywood wanted this story with a happy ending, but he also pointed out that Imagine Entertainment had announced its plans to remake Psycho. So the two poles continue in a way to shape how people think.
Yeah.
Thank you so much. I've really enjoyed this conversation. Towards the end of your remarks, you were talking a lot about autonomy, and it seems we place a very high cultural premium on autonomy. And so I'd love to hear some of your reflections on how kind of your friendship with Michael and kind of thinking about severe mental illness has shaped your understanding of our kind of society's relationship with the value of autonomy.
That's a great question. I don't believe that it's only that I would reevaluate the value I place on autonomy. I would reevaluate the way people understand illnesses that rob people of their autonomy. When Michael and I were freshmen, there was an article in the Times about a woman who froze to death in a box. And she was just called the lady in the box for quite a while, and then her daughter recognized her, identified her, and she had a name, and she'd been the valedictorian of her high school, and she'd spent 10 years in a psychiatric hospital, and she had fled and died on the street. And the person in the city, the person who worked for the city kept saying, we wanted to respect her wishes. And Thomas Zaz, who had written one of the really notorious books in the 60s called The Myth of Mental Illness, he's a psychiatrist who denied the existence of mental illness, wrote a long article about the lady in the box, whose name I'm forgetting, which I feel bad about, Rebecca Smith, saying that it was pathetic, as he said, that she could not perform daily functions, but it would have been tragic to hospitalize her for an imaginary illness. And he styled his defense entirely as a defense of civil liberties. But I guess the way I think about that is I believe very strongly in free speech, right? And I understand that you can't yell fire in a crowded theater unless there's a fire. But I would like to think people who feel that way too would believe that if somebody thinks there's a fire, but it's only in their mind, that would not be a good exception to the free speech rule. And so, in a way, it is easy to blame society's obsession with free speech, much as it would be, many people think, oh, it's the failing of the meritocracy, in a sense. But the meritocracy is supposed to be doing a very specific thing. People who are very good at something, or good at these tests and go to become lawyers, can be really good lawyers. But if the people who are the beneficiaries of the meritocracy decide that it bestows on them the very mysterious authority that had prevailed before there was a meritocracy, which is how they had gotten in, then you're doing something very, very different. And those are the things that kept also coming up in a way. And so, yeah, I definitely think, the Atlantic piece at least ends with this conversation that I had with Michael, and he got off of it very abruptly. It wasn't that long before he killed Carrie. He said, I'm having thoughts I shouldn't be having, and I have to go. And I, wrote it in my journal. It did not occur to me at all that might indicate something extreme that required my intervention or my attempting an intervention or my attempting to contact somebody who could attempt an intervention. It simply didn't. And that I'm ashamed about.
Oh, I saw a hand. Does anyone else have a question? Oh, sir.
Thank you. Fascinating and terribly disturbing. Beyond Foucault and Goffman and Zaz and Lang, these institutions that were being criticized are widely seen as, in retrospect, as awful and often inhumane. And some of the ones today are not so appealing. So what are your thoughts about what the alternative is in terms of the sort of involuntary confinement? Certainly the way it was then, it can be hard to be an advocate of. I think many certainly would say regarding what the conditions were then and to some extent today. So just how much does that worry you in terms of the alternative to what these individuals, where they would have been in the 50s and 60s before they were discharged?
Yeah, that's a great question. And one of the reasons, it's funny, sometimes when I'm interviewed, people want me to begin with the state hospitals, which they refer to as snake pits. They were in this horrible, degraded state. And that is absolutely true. But I do think it's useful for people to remember that when they were created in the 19th century, people were living on the streets. People were not just living on the streets, they were dying on the streets. They were locked in basements, chained to walls, beaten, because even in the 19th century, there was a belief that they were possessed by demons and needed the madness beaten out of them. And Dorothea Dix, who was a great reformer for religious reasons, really, and partly also because her father had been homeless, he was an alcoholic, and I think he suffered from mental illness, went to every governor of every state and persuaded them that a civilization worthy of the name needed to grant asylum to people so that they didn't die on the street. And they were beautiful by design. They had landscaped gardens. They believed getting out of the city was a healthy thing. People worked in, there were dairies, there were farms, and they were light and airy and designed that way too. And it was called moral care because there were no cures. And actually, before they became horrifically overcrowded, in the absence of care, of medical treatment, it was humane care, moral care. And lots of reasons why it all went south in all kinds of ways, partly just the growth of the country. People moved more to cities than to the country. They didn't care for members of the family. People lived longer. Dementia suddenly was a huge factor. A tremendous number of people in the institutions, by the time the institutionalization began, had dementia. And it's like schizophrenia used to be called dementia praecox, like premature dementia, which was false, actually. You can remit 20% of all the people who have a psychotic break don't have another one, which means if you're a young person and you're sent to an asylum in its early days, you might well come out after a year, or if you have bipolar disorder, you had a place to go. But over time, many of these things happened. But ironically, the experiments with community care that were being done around the time of deinstitutionalization were being done by state hospitals. And so there were satellite facilities. In fact, the one in New Rochelle, run initially by the community psychiatrists who Michael was close to, was a satellite of Harlem Valley Hospital, the very place they were trying to shut down. But it meant that if you became ill, you could go back to the hospital. Once they emptied everything out, partly because you couldn't get a reimbursement, partly for all these other reasons, partly because they thought medication would do the trick, and then laws slammed the door behind them, and you could only get in if you were violent. They didn't all close, many did close, but they couldn't all close because they were the only place who would take patients, but the patients who they took were violent. And so the character got even worse. But there had actually been experiments that were done via state hospitals that were models. Instead of a kind of imaginary notion of starting entirely anew, you know what I mean? Like scotching the old system, treating every state hospital like the Bastille that had to be knocked down so you could replace it with a community mental health center, was so out of tune with any kind of reform. And reform was taking place. Irving Goffman, who wrote Asylums, was there doing his kind of undercover work. He was an athletic director, so he didn't write about that. He didn't talk about, there were all these clubhouses for people who had left, who were helping those who got out. There was a newspaper. He didn't talk about giving tennis lessons. I mean, all of that was eliminated simply because that wasn't his interest. His interest was, he didn't talk to any patients. There was no experience at all. And so, but what I would say is, and I had wanted to say it at the end of what you were saying. Now, I'm trying not to turn my head so that my mic doesn't go flying. I'll move slowly. But that a lot of the care today can be given as outpatient treatment. And so in a way, the community mental health movement had, the impulses behind it were good and correct. And if it's focused on those who are truly ill, and medication is understood to be something that in certain cases people will not accept, like assisted outpatient treatment is a form of commitment. That's an outpatient treatment. No one's coerced into doing it, but a judge orders it. And so it may urge someone who might otherwise resist care or treatment to accept it. Facilities that have supportive housing, not something that was created by the community mental health movement, that builds services into housing. And the people who did it just started rescuing all these SROs, single room occupancy dwellings in Manhattan that were all being bulldozed because suddenly everything was going co-op. And it was a couple of friars in Chelsea, and it was a social worker uptown. And little by little, they discovered, here's a real model. And I guess that what I would say is in the same way psychiatry had to rebuild itself. Maybe I'm wrong, you'll tell me. But listening to stories is really important, and medication can be really important. It has to put itself together, and the best psychiatrists I know do. You listen to stories all the time and also understand the biological piece. But community care with a hospital component is a better model. My book was originally called No Going Back, for every reason. There's no going back to the time of asylums. There's also no going back to the time before Michael killed Carrie. There's no going back to the past, although the first line of my book is, I am going back. But paradox is something that is built into this discussion. And so people often imagine that what's being argued when people speak about hospitals, they don't realize there aren't even any beds. that they're not talking about a back ward where you'll stay for infinity. And I think partly it would also be useful if people understood. I certainly looked at the ruins of psychiatric hospitals, those huge collapsing castles that you can still see, as if they were always like that, as if they were always the haunted house setting. And I have a collection of photographs with an introduction by Oliver Sacks, who talks about their decline, but then he mentions his brother who had schizophrenia, who found true asylum in those places. And it's, I guess, the need for asylum itself, wherever it is located, even if it's located in the community, that cannot be lost, because that is something people need to be like granted. So I just don't think it's really, no one is arguing. Maybe every now and then you see an eccentric article, bring back the asylum. That is so, it couldn't happen and it wouldn't happen. But there are people who need, and the people who study these things, you do, Fuller Torrey does, they talk about you need this many beds, and it's not a huge number. It's not the 500,000 people who were in state hospitals in the 50s at the peak of hospitalization. But we shouldn't forget that they were built to provide moral care, and that was a beautiful act of reform that should be like honored, I think, by the next generation.
It seems like a great place to end. Thank you, that was excellent.
Well, thank
Very
you.
moving.
Thank you.
And thank you all for coming. And I think you'll be signing books.
Yeah.
Okay. And if you have questions, you can ask them. So thank you so much.